Ladies and gentlemen, this is Dr. Lewis from the Health and Wellness Spot. Welcome to yet another informative video that is labeled stroke. What is stroke? What are the symptoms of stroke? Now, on the symptoms of stroke, when I was doing my clinicals, I was told that the first of the initial symptoms of stroke actually have an acronym, the FAST, F-A-S-T. And I kept wondering how the T is a symptom, because T is basically time. And as we'll be talking about this topic, you'll get to understand a lot of things. So basically the first, F is for face drooping, A is for arm weakness. Either arm, one arm or both arms will get the weakness and numbness. S is slurred speech. And then T is time to call for emergency services. And I know if you're a medical student or a pharmacy student, you've basically had this conversation and you're wondering, how is time a symptom of stroke? So basically we just crammed that, and then of course we pour it on a paper, an exam paper, and we forget about it. Now somebody asks you about stroke, the first thing that comes into your head is of course the fast, but you've never thought about it, that how is time a symptom of stroke? So in this video I'm going to show you those symptoms that somebody can start experiencing. For example, sudden confusion, a very severe headache, vision problems and impairment, sometimes difficulty in swallowing, even breathing. Okay, these are the symptoms. And now we start getting to the arm weakness and the facial drooling or drooping. These are the symptoms that you actually see and you identify this person as possibly going through a stroke. Now, those are very specific symptoms, and you will see why I'm talking about those symptoms. Strokes are very dangerous, and the reason why I've decided to talk about this topic is because the complication of stroke can be actually life impeding. They can actually destroy your life in general. For example, the paralysis that comes after the strokes. For example, difficulty in swallowing or difficulty in actually communicating, a slurred speech, and also memory problems. The cognitive function is actually impaired afterwards. We also have depression, and even the side effects of medication that actually coming in to help you recover from the stroke can bring you more complications. And then, of course, after you've treated one stroke, it doesn't mean that is over. There is a possibility you can end up getting another stroke. So what is a stroke? A stroke is basically destruction of the brain tissue as a result of blockage or reduced blood flow towards the brain. And on this board, I've actually demonstrated the structure of the brain. I am not a good artist, but I've actually tried. So the brain and its lobes. Basically, we have the frontal lobe, we have the temporal lobe, we have the occipital lobe, and then the parietal lobe. Down here, we have the cerebellum, and then the spinal cord as it extends into the back. I want you to know this, that there are blood vessels that actually supply this tissue. And those blood vessels, when you block them, you will actually start impeding the function of the brain tissue. And remember, those blood vessels are actually carrying blood to the brain, and blood carries oxygen. And because the brain is a tissue that relies highly on oxygen, it needs it. So we are taking oxygen to the brain, we are taking nutrients to the brain, we are taking immune cells, because when the meninges are actually starting to get inflammation because of viruses, bacteria, chemicals and all that, we require immune cells to go there to start the healing process. And therefore the blood is actually ferrying immune cells towards the brain. So blood flow towards the brain is very, very important. But when you start having these blood vessels that supply the brain, having the occlusion or narrowing or thinning, the diameter coming narrower, that means the amount of blood that is actually ferried to the brain has now reduced. And that tells you the brain will not get energy, the brain tissue will suffer, and it starts becoming ischemic. Ischemic means you have reduced oxygen flow towards a tissue, and that tissue start dying slowly, necrosis. So that is what is happening in the brain, and that's how you end up getting a stroke. Now, depending on the part of the brain that this blood vessel supplies, it will get a different stroke, and you'll get different symptoms. For example, the right side of the brain, if it's affected, of course, the left side of the body will be the one that will be impaired, and vice versa. So this is a normal blood vessel, and this is a blood vessel that already has inflammation. This is actually going to be explained easily through the video that we did about atherosclerosis. Understand, that is narrowing of the blood vessels that supply tissues. So sugar again becomes the serious culprit here, because sugar is the one that causes these problems, and the inflammatory foods in general, the seed oils, the wheat products. So once you have this inflammation, and now the blood vessel starts to narrow, we are now limiting the blood flow towards the brain, and that is going to cause us a stroke. And you will see we have classified stroke into two broader categories, actually three, but the two major ones will actually show you, because one is ischemic, and this is where it starts. So now blood flow towards the brain is now limited, the brain tissue starts to die, and now that leads you to a stroke. Now understand this, that we said cholesterol comes in to form a thin layer here on the inflamed sites. When cholesterol comes in to do that, we have further narrowing of the blood vessel. So yes, cholesterol can actually be implicated in strokes, but not as a risk factor as such, because it's coming in to solve the problem here. But we'll get to that. So now you've understood this. Remember, also sugar is coming in to actually cause inflammation to this blood vessel wall and causing it to be narrow. Once it becomes narrow and the blood pressure is increasing, what is going to happen is there will be a formation of something like a balloon, and this balloon can easily rupture to start, you get the bleeding in the brain. So for example, if this blood vessel is the one that supplies the brain, and then now it ruptures in the brain, that is what we call hemorrhagic stroke. So this ballooning is what we call aneurysm. Okay, so that is part of the causes of strokes. So hold this thought and let's get into the real case, which are the types of strokes. Understand this, that stroke is classified into two major categories. The first category is the ischemic stroke. Anytime you hear the word ischemia, it basically means you have narrowed the blood vessel, you have limited blood flow towards the tissue, and now that tissue starts to suffer because there's no oxygen, there are no nutrients, there are no immune cells towards that tissue. So ischemic strokes are actually 80% of the types of strokes that we experience. And you see, if there are 80% of the strokes, that tells you sugar is the enemy. You understand that? So hold back again. Let's keep going. So on ischemic stroke, where we have occlusion and narrowing of blood vessels that supply the brain, and now we have limited or reduced blood supply towards the brain, we also classify them into two. One is what we call the thrombotic. Thrombotic means we have a thrombi, a clot. Now, there's a difference between thrombotic and embolic. I want you to understand, thrombotic is a blood clot that has formed in the brain blood vessel. So it is in the brain. But the embolic, this blood clot formed somewhere else, and then it traveled with blood all the way to come into the brain and block the brain tissue. That is the difference. So when somebody talks about thrombotic stroke, it is a type of ischemic stroke, which means blocked and reduced blood flow towards the brain, but it is a blood clot that actually formed in the brain tissue, in the blood vessels that are actually in the brain. But the embolic one is the one that actually happens is most women who are actually on hormonal contraceptives. People who have deep venous thrombosis, those veins that are occluding and forming clots in the legs. This is what is going to happen. You form an emboli, a clot or any other debris, fat globules, cholesterol tissues, cholesterol globi, emboli, sorry. And this is carried by blood all the way into the brain. Sometimes it forms in the lungs, sometimes it forms in the heart, and then when the heart is pumping blood, that clot moves into the brain, and when it gets into the smallest or the narrowest blood vessels in the brain, it can occlude them, causing ischemic stroke. So those are the two types of ischemic stroke. On the other hand, we have the hemorrhagic. Anytime you hear the word hemorrhage, it means bleeding. Now this hemorrhagic is where you have high blood pressure, and that high blood pressure is coming in as a result of narrowing of these blood vessels. And remember, because sugar is causing the inflammation of the blood vessel wall, and now it's starting to thin, there will be increase in blood pressure that will cause an aneurysm, that bulging of the blood vessel. And this bulging will not stay long. As the pressure increases, it can end up rupturing. And when it ruptures, you end up bleeding in the brain. So when there is bleeding, there's blood in the brain, that is hemorrhagic stroke. And again, the hemorrhagic stroke is actually classified into two. One is in the intracerebral. Now, intracerebral, it basically means you're bleeding directly into the brain tissue. Contrary to the other one, that is subarachnoid. Now, on this board, I drew the image of the brain. And when I drew the image of the brain, if you're keen enough, you'll see there are layers here. We have the black layer, we have the blue layer, and the red layer. These are the meninges of the brain. They cover the brain and they cushion the brain against harm. And inside these meninges, these are the ones that when they get inflammation, you get attack from bacteria or viruses or protozoa, you get this to be inflamed, and that's what we call the meningitis. Now, inside these meninges, we have spaces. And those spaces are what we have. We also have fluid there, and that fluid can actually, and the blood vessels in here, and those blood vessels, when they rupture, they will give you subarachnoid hemorrhage. So any blood that is inside these meninges is what we call subarachnoid hemorrhage. And any blood, any bleeding that happens inside the brain tissue directly, that is what we call the intracerebral stroke. So we have two: intracerebral and subarachnoid. Do not struggle to cram these names. Simply understand, we have one that causes you bleeding into the brain tissue directly. We have another one that causes you bleeding into the spaces. So these meninges are organized into three. We have the DAP. So D is the dura mater, A is the arachnoid, and you've seen here subarachnoid, and then P is the pia mater. So those are the meninges of the brain, and they are arranged that way from outside into the inside of the brain. So hold to that. Let's keep going. So these are the two types of the strokes: the ischemic and hemorrhagic. However, most times when you review the ECGs, you review the tests and the scans of people who actually have hypertension, who have diabetes, people who have been on medication for the longest period of time, and sometimes people who are admitted from fainting, and the scans will show you that there was something. At some point, this guy suffered a stroke, but they did not know. Okay, so they come in, you ask them, have you ever suffered a stroke before? They say, no, I've never suffered a stroke before. And you ask them, okay, but your scans are showing there was a stroke. So you are not told about anything? They say, no, I have never suffered any stroke. That is what we call the TIA, the transient ischemic. Remember ischemia? So transient ischemic attack. What does that mean? This is what people call the mini stroke. Okay, the mini stroke. So you have this blood vessel that supply the brain partially occluded, and therefore they limit blood flow towards the brain, or you have a clot that is actually blocking these blood vessels, but these symptoms resolve within the first 24 hours. So the clot can be lysed naturally, or the blood vessel, the occlusion can actually disappear within 24 hours. So their symptoms will disappear within the first 24 hours to 48 hours. Therefore, to them, they just fainted, went to hospital, got an admission, they were treated, everything went back to normal, and it disappeared. So they don't know they actually suffered a mini stroke. However, this TIA is very dangerous because this is a red flag. It already shows you, you know what, at some point you might end up suffering ischemic stroke. So it's time for you to start actually changing your system. Start changing your lifestyle totally, because you are at the red zone. So this one is an indicator, it's a red flag. Okay, so understand that. Now, these are the types of stroke. Once you understand this basis, you'll simply know if my stroke is ischemic, if I have a diagnosis of ischemic stroke, therefore I must do away with what is blocking the blood vessels. Therefore I must change my lifestyle and my kitchen. If I have hemorrhagic stroke, this one you don't have any option. Remember, these two conditions, all of them, they need hospital management. They need an admission and monitoring. But when you survive and you get the diagnosis of ischemic stroke, simply know you're actually consuming a lot of foods, or your lifestyle is actually encouraging the occlusion of blood vessels. So you have to change this. But if you're having hemorrhagic stroke, this one can be open. You can have an accident and then end up bleeding in the brain. You can have hypertension, and hypertension is actually coming in handy in terms of this hemorrhagic stroke. So when you have hypertension, your blood vessels in the brain can actually rupture. So those severe headaches that you get all the time, do not ignore them. And women who are on contraceptives, you get these headaches all the time because of increase in pressure. And you assume them. You just take maybe paracetamol and you're good. And these headaches are constantly coming in. It's time for you to go and do a scan to just see what is happening. Okay? Because this can actually lead you to hemorrhagic stroke, and that's a problem. Now, so therefore, risk factors or the causes of hemorrhagic stroke, hypertension is one of them. Of course, we have aneurysm, which you just explained there. But aneurysm is actually coming in as a result of the diets and also an increase in blood pressure. And then we have AVM. AVM is basically in the brain. We have these connections between the veins and the arteries. So sometimes children specifically, most of them are born, some of the children are actually born with a problem in terms of the connection between the vessels, which are the veins, and the arteries. And that can actually cause a rupture. And of course, trauma, which is basically physical. So either head injury or all that, they can cause you hemorrhagic stroke. Okay? Now, what are then the symptoms of a stroke? When you come to the symptoms of a stroke, I told you I was told about the FAST, FAST as an acronym, and I kept wondering, what is the time? How is time a symptom? And I've carried this all my life, still believing that actually time was a symptom. So I kept on asking, how is time a symptom in terms of stroke? But this is the reality. This is just an acronym that the syllabus gives us. But the reality is the symptoms of stroke are very, very obvious. You can easily stab them out. When you see somebody having this drooling face, either one side or both sides, when you see somebody having this difficulty in having a conversation, communication, speech is sluggish, when they're trying to swallow something is difficult, they can't swallow it. These people complain of headaches every single day, and it's persistent headache and very throbbing. These people end up having dizziness, and when they do a blood test, they're trying to look for HBs, their blood levels are normal. Okay, these people have vision impairment, so they're struggling to see. And that vision struggle is actually the one that can actually exacerbate the headaches. So people who have eye problems also experience such types of headaches. But most importantly here, you start seeing that facial drooping, you start seeing that arm weakness. So this guy was just normal, and then now he cannot hold something. He cannot even coordinate the muscles. Those are the symptoms of a stroke. So basically, the FAST was just telling you facial drooping, and then arm weakness, of course, and then speech impairment. Now, these symptoms can actually turn into complications later on, because you see, the facial drooping, if you don't take care within the first 3 to 5 hours, this can actually be tragic. They can cause permanent impairment, and you will end up having that facial drooping all through. You can end up having those arm weaknesses every day of your life. You can even have speech impairment and even memory and cognitive impairment all your life. So therefore, it's very important that you protect yourself from the occurrence of these strokes. But the most important part here is that most people don't take care of themselves. Most people, they will argue about diet and lifestyle modifications because they don't have the information. They will want to eat whatever they've been eating to maintain that life, and then they will rather actually prefer treating the stroke than preventing the occurrence of the stroke. That's the saddest part about my practice, that you meet people who have suffered a stroke, but they don't want to change their lifestyle. They've been doing the same things over and over, and they think that medication can actually come in to change their situation. Now, that physical therapy that you're doing, that occupation therapy, that speech therapy, all these things are very demanding, and the complication of stroke will lead you to brokenness. You will get broke just fixing the complication of a stroke, things that you can actually prevent. So as you consume that seed oil, as you consume that wheat product, as you consume that sugar, you are actually exposing yourself to these problems. And I wonder why people think that some of these problems, like when you tell somebody about diabetes and the complication of diabetes, you tell them about stroke, but they will ignore that. They will forget that. And when they suffer a stroke, they'll ask you, Daktari, how do I manage stroke? I have been watching your videos, and I saw your video on diabetes. I even saw the video on complication of diabetes, but I don't know how to treat stroke. So they are thinking the treatment and management of diabetes is actually different from a treatment of stroke or prevention of a stroke. The reality is, this occlusion is a sugar problem. This is a lifestyle problem. Therefore, change the lifestyle. If you change the lifestyle, diabetes disappears. You will not get an occurrence, because strokes are actually complications of diabetes. So our major enemy in this is the sugars that we are consuming every single day. So as you add that sugar in that tea, in that coffee, start thinking, am I even trying to help my body, or am I working against the body? And you realize most times we work against the body. So we are expecting that now, because it's a stroke, it has to be managed differently, and the prevention is actually different. No, they are the same. When I tell you about lifestyle modification, when I tell you about embracing exercises, sleeping, easing up on stress levels, enjoying the sun, working out, eating healthy and fasting, I'm actually helping you to prevent the occurrence of these problems. Because when you fast, you're clearing up the blood vessels that are actually occluded. You're clearing out inflammation. Therefore, no risk for the strokes. When I tell you to eat fatty meats, you start telling, you know what, I can't eat fatty meats because they will occlude my blood vessels and they cause me a stroke. I'm looking at you and wondering, who lied to you about that? Because the reality is, you are not eating fatty meats, and you've never eaten fatty meats for that matter, but you ended up having a stroke. So how did you have a stroke when you've not been eating these foods? Start asking yourself these questions. How did I end up having diabetes and having high blood pressure, having strokes and heart attacks when I've not been eating fatty meats? I have never used ghee or tallow or coconut oil all my life, but I suffered a stroke. So when somebody is telling you, you know what, stop eating the saturated fats, and you've never eaten them anyway. So how did you end up getting a stroke when you're not eating the saturated fats? Do you see where the questions come in? And when you ask these questions, possibly somebody who is actually attending to you in terms of medical, they'll become so upset. But this is the reality, because I remember all my life I've never consumed animal fats. I remember when my mother used to prepare the animal fats when we were young, the smell was so annoying. So we didn't like that. But now I'm the one who is enjoying those animal fats. because of the complications that came in later on in life. So you can actually prevent these things. And on the strokes, prevention is better than cure, because remember, this one, you have nothing to do. You can't cure yourself from strokes. You need a hospital admission where they'll have to do either catheterization to actually remove the clots in the brain. They'll have to do a surgery to repair the damaged blood vessels. They'll have to actually give you drugs, the thrombolytics. They'll have to basically do a surgery. They'll give you drugs for medication for hypertension. So these things are very expensive. Now they'll have to refer you after you've come out of the hospital. Physiotherapy is there, occupation therapy is there, speech therapy is there, and all these things you're spending money on. The only thing you can do, and the easiest thing to do, is actually avoid things that are actually exposing you to the stroke. And what are those things? Of course, the risk factors of stroke. Number one is age. We can't do anything about age. We can slow down the biological aging, but we cannot halt aging. So what do? We make sure we age gracefully. We don't waste our muscles. We don't cause inflammation to our system, so that as we age, the body works with us. Therefore, what do? Age, we can't do anything about it. We can't do anything about the genetics. But remember, genes play a 2 to 10% of roles in health conditions, including strokes. These are things we have no control over. But we can control the genes that actually cause us diseases, because we are not responsible for genes, because everybody has genes. But we are responsible for things that are called epigenetics. Epigenetics are things that actually turn on or off the genes that cause us diseases. Just the same way I always tell you, you are not diabetic because of the genes. Nobody was born to just be diabetic. No, it was never casted on a stone that you will suffer diabetes just because your mother or your father suffers diabetes. The reality is this: we don't inherit genes for diabetes. We inherit diets that activate genes that cause us diabetes. I repeat, you will inherit diets that activate or turn on the genes that make you suffer from these chronic conditions. So when somebody is telling you about genes, please remind them about epigenetics. Tell them about your lifestyle. Tell them about your diets. Tell them about your environment, smoking, alcohol. Those are what we call the epigenetics, and these are the ones that actually contribute largely or immensely to activating the genes that cause us diseases, including cancer. Okay, so all of us have these genes, but the rate at which we turn them on is different because of our differences in epigenetics. But the most important one is hypertension. So therefore, avoid the inflammatory foods, because when we avoid the inflammatory foods, your system clears up the blood vessels, your blood pressure goes back to normal. It will be maintained there. So you don't need medication later if you're told you're eating and maintaining a healthy lifestyle. Diabetes is coming in as a risk factor, and that is again a sugar problem. Alcoholism is coming in because of a fatty liver, which will cause you diabetes later on, or insulin resistance. We talk about smoking being associated with 80 to 90% of health diseases. So why are we still smoking? Why are we still abusing cigarette smoking and alcohol? Diet is very necessary, because 85% of your health is in the kitchen. Change the diet. Drop all the inflammatory foods. Eat healthy foods. And then anytime you eat, make sure you must fast, because you have to give your body a chance to digest, absorb, assimilate, and then give you this energy later on. And also the gut has to have some time to clear up. When the gut clears up, it rests. Now you can bring in new food. Some of us eat every after 2 hours. So your gut never rests. Your body never cleans up. The liver never finds time to detoxify. So before you even digest the food, it's being pushed into the small intestine, causing you more problems. So why don't we give our gut about 6 to 8 hours to actually work it out and rest? After resting, you can bring in. Your system is highly mechanical. The gut is highly mechanical. So you can imagine how much activity is going on there. It actually needs rest. Even yourself, after working hard during the day, you have to rest during the night. So the gut also needs to rest. But look at you eating even before the bed, before going to bed. And most people who have been diagnosed with diabetes are told, eat a bedtime snack. That is one of the statements that's actually so skewed, because you're eating in the morning at 8, you're eating at 10, you're eating at 1, you're eating at 4, you're eating at 7, and at 10 in the night. Those are 6 meals. I haven't even counted the snacks that you've done in between. So why are you eating all the time? You are not designed to eat every single time. At least give yourself 6 to 8 hours between the meals. That will take you to only 2 meals a day. Okay? So that will actually change your situation in terms of prevention of getting to the strokes. Obesity is a major risk factor, and of course obesity is linked to diet, alcoholism, and the lifestyles. Okay, and then women who are on hormonal contraceptives, we cannot say this enough times. We will keep on saying it over and over. Hormonal contraceptives, once they expose you to a risk of blood clots, which will occlude your blood vessels and cause you an ischemic stroke. Number two, They cause you deep venous thrombosis. They cause you a lot of problems. And when you're discussing about menopause, we talked about the side effects of hormonal contraceptives. Therefore, ladies, understand that birth control is in the hands of men. It is in the hands of men. If you go to the extremes, at least use a copper IUD. But all other hormonal contraceptives, whether progestins or estrogens, stay away from those things. The reality is, it looks good now, but later on, it will become a serious problem. And men, do not push your women into using hormonal contraceptives. It is unacceptable. This is what you'll experience 7, 10 years down the line. And then you start asking, how did I get a stroke? And of course, somebody will convince you it is in your genes. You know what? Somebody in your genetics must have suffered a stroke. And of course, in our lifetime, there's somebody in our lineage who has suffered a stroke. So once you're pointed in that direction, you realize you cannot do anything about yourself. You cannot change anything because you know it's in the genes. So it's basically me telling you, you know what, sit in the same position, keep doing what you're doing, and you know what, I have therapy, I have medication for you, I have solutions in terms of occupation therapy later on, I have surgeries here. So please walk out from that. Always understand that there's no pill that can actually change your kitchen. It is just you who will change that kitchen and your lifestyle in general. And the weird part is, even after explaining this, I know I still get people who have suffered a stroke before, or just general people who are trying to prevent themselves from getting a stroke, still asking me, Daktari, after I have recovered, and I get this question all the time, you know, Daktari, your dietary modifications are very okay and they're very practical, but after I have actually achieved my goals, can I go back to eating chapati once in a while? Can I go back to using a seed oil just once in a while? So you want to actually maintain the same lifestyle and hope that this same lifestyle can give you different goals. It's not going to make sense. Immediately you get into a healthy lifestyle, that becomes your new journey. There's no going back because you're actually giving your body what it needs for repair and rebuilding. And the body now starts to protect you from getting into trouble. So I thought you should understand stroke. Once you understand the causes, once you understand the risk factors, you simply do away with the risk factors. When you do away with the risk factors, you're already into 50% of your recovery. Because diets, fasting. And when you're diagnosed with stroke, please do not stop drugs and jump into dietary modification. After the diagnosis, it will be only fair that you keep on using the medication. You have to use the medication until you attain a certain level of blood pressure control, of blood sugars control, and then you go for several checkups to just make sure that your system is now clear. When the system is clear, now you can start tapering down medication with the help of a healthcare provider. This is not a video to tell you to just jump into dietary modifications and drop medication. If at all you've been diagnosed with a stroke before and there is a risk of a stroke, don't drop the medication. Use the medication as you introduce the new lifestyles. And then once you attain a stable flow of blood sugars and a stable control of blood pressures, you can talk to your healthcare provider to start helping you taper down the medication. And that's how you win off the medication. For those of you who have never been diagnosed with a stroke, of course, you now know what to do to actually prevent the occurrence of a stroke. And if you're nursing somebody who has a stroke, understand that this is totally a serious condition that can actually come back. Once you have one stroke, there's a chance that you can actually get another stroke. But this is for those people who will still do the same things that they used to do before they got a stroke. For example, those people who still eat chapati now and they ate chapati before the stroke. Those people who still use the seed oils, the vegetable oils that they used before getting the stroke. Those people who still drink alcohol right now that they used to drink before getting the stroke. So all the factors that gave you the stroke should be dropped. Okay, once you drop those factors, of course, a stroke is a symptom of those risk factors. It's that simple.